Hello, my name is Ariana Estrella and I'm going to talk about autoimmune polyendocrine syndrome. In definition, autoimmune polyendocrine syndromes comprise a diverse group of clinical conditions characterized by functional impairment of multiple endocrine glands due to loss of immune tolerance. These syndromes also frequently include conditions such as alopecia, vitiligo, and celiac disease, and autoimmune gastritis with vitamin B12 deficiency that affect non-endocrine organs. We have now come to appreciate that these syndromes can be broadly categorized as rare monogenic forms such as autoimmune polyendocrine syndrome type 1 or APS1 and more common polygenic variety autoimmune polyendocrine syndrome type 2 or APS2.
Autoimmune polyglandular syndrome type 1, also called APS type 1 or autoimmune polyendocrinopathy candidiasis ectodermal dystrophy, also called APECED, is a rare genetically inherited condition. Autoimmune means that the body's immune system begins to attack its own tissues, and polyglandular means that multiple hormone-producing organs are affected. Normally, your body should only react to things that are foreign or not self. This is maintained by a process called immune tolerance, where only non-self-reactive B cells and T cells are allowed to mature, whereas self-reactive ones aren't. For T cells, this process takes place in the thymus, where a gene called AIRE, or autoimmune regulator, is expressed by thymic medullary epithelial cells. When T cells are developing, this gene leads to the production of thousands of the body's proteins, and this serves as a test to see whether the T cells react to self proteins. If one does, that T cell either undergoes apoptosis and dies, or it becomes a regulatory T cell, or Treg, that helps to eliminate other immune cells that react to self antigens. In APS type 1, there's a genetic mutation in AIRE that's usually inherited in an autosomal recessive fashion. This means that the thymic medullary epithelial cells lose the ability to display the body's different self-proteins. Since they can no longer test whether T cells are self-reactive or not, the process of immune tolerance does not occur normally, and self-reactive T cells are allowed to live. Regulatory T cells are no longer produced normally either, so the body loses a second mechanism for destroying autoimmune cells. This allows for the production of antibodies and lymphocytes that target normal tissues of the body. It is still unclear why, but certain glandular tissues, including the adrenal glands and parathyroid glands, are particularly targeted. There are multiple characteristic signs and symptoms of APS type 1. One of them is polyendocrine malfunction, resulting in hypoparathyroidism, characterized by low calcium and elevated phosphorus in the blood that can cause muscle cramping and seizures, and primary adrenal insufficiency, also called Addison's disease, which can reduce cortisol and aldosterone levels. These hormones normally help to maintain blood pressure among many bodily processes, and their loss can be life-threatening. In addition, chronic mucocutaneous candidiasis is an infection with the yeast Candida that affects the skin and nails, as well as mucous membranes, like the mouth, esophagus, and genital mucosa. There's also ectodermal dystrophy, which leads to skin abnormalities like vitiligo, which causes areas of hypopigmentation in nails and corneas, reduced dental enamel, and alopecia, which is where there's hair follicle destruction causing bald spots. Finally, some non-endocrine organs like the liver, intestine, lungs, kidney, salivary glands, and spleen can get inflamed as well. Recognizing the clinical pattern early is particularly important in terms of making a diagnosis and starting treatment early.
In applications in medicine, autoimmune polyendocrine syndromes are characterized by an insidious presentation, circulating autoantibodies and lymphocytic infiltration of the affected tissues or organs, eventually leading to organ failure. Presentations can occur from early infancy to old age, and new components of a given syndrome can appear throughout life. There is marked variation in the frequencies and patterns of autoimmunity in affected patients and their families, and the risk of developing various organ-specific autoimmune disease is likely due to a combination of genetic susceptibility and environmental factors. In pros and cons, pros, the onset of APS2 typically appears later than APS1 in young adulthood. Currently, there are no unique tests to detect patients with APS2, but testing for autoantibodies may be helpful in assessing disease risk, since the relevant autoantibodies are frequently detectable years before disease onset. In general, patients with APS1 have an increased risk of mortality due to cancer, adrenal and hypocalcemic crisis, and certain conditions issued by aberrant autoimmune responses, particularly hepatitis, nephritis, and pneumonitis.
Hi everyone, thanks for listening to my presentations. Today I'll be talking about polyglandular autoimmune syndrome type 1 and 2. If you haven't listened to my presentations on adrenal gland, please kindly do. I have published 7 presentations on my channel when it comes to adrenal insufficiency. Okay, with that, let's go. Polyglandular autoimmune syndrome type 1 is also known as autoimmune polyendocrine candidiasis ectodermal dystrophy. The autoimmune polyendocrine candidiasis ectodermal dystrophy is associated with mutations in autoimmune regulator gene on chromosome 21. That is found in thymus, lymph nodes, pancreas, adrenal cortex, and fetal liver. Polyglandular autoimmune syndrome type 1 is a very rare condition and it is recessively inherited. There's likelihood of multiple autoimmunities associated with HLA-DR and DQ genes that involve and actually play part in the type of autoimmune that the affected person will eventually develop. The features of polyglandular type 1 are essentially that there will be more hypoparathyroidism than you are going to find in type 2. The chronic mucocutaneous candidiasis of the mouth is the hallmark of polyglandular type 1. The candidiasis is first to appear among all the symptoms, and it will be recurrent. It's going to appear within the first 2 years of life. Can be found on the nails, diaper rash, and the skin of the affected child. The adrenal insufficiency will occur later in life between the age of 10 to 15 years. Hypogonadism is the primary problem in about 60%. But you'll be dealing with hypothyroidism and type 1 diabetes as well. There's likelihood of hypopituitarism and of course central diabetes insipidus. Other features of polyglandular type 1 that will be non-endocrine in nature will include malabsorption syndrome, alopecia totalis or alopecia areata, pernicious anemia, vitiligo, and chronic active hepatitis. Okay, now polyglandular autoimmune syndrome type 2, formerly known as Smith syndrome. And here is going to be all about adrenal insufficiency. The autoimmune thyroid disease is greater here than in type 1. Type 1 diabetes mellitus is greater here than in type 1. We'll also be battling with primary hypogonadism. Also, we're dealing with central diabetes insipidus. That's we're going to have less hypopituitarism and less hypoparathyroidism.
An issue applied in Ecuador, monogenic autoimmune polyendocrine syndromes have provided an opportunity to learn more about specific factors that are critical for maintaining immune tolerance. In parallel, major advances in characterizing autoimmunity in patients, such as the identification of new autoantibodies targets associated with distinct disease and their manifestations, have occurred. In conclusion, research in the next decade should focus on prevention and targeted treatment of autoimmune disease. More knowledge on genetic mechanisms and environmental triggers may permit subclassifying APS into distinctive entities that have relevance for treatment and prognosis. Combining early and refined diagnostic with personalized genomics could enable physicians to apply early immunomodulatory therapy to stop the autoimmune process before irreversible organs damage occurs. Thank you.